Should I use ice or should I use heat? It seems simple, right? But using the wrong one can actually slow down your healing or make your pain even worse. So let's dive into when to use ice, when to use heat, and why it matters so much for your recovery. Let's start with ice. Ice or cold therapy is perfect for acute injuries. That means injuries that are sudden and usually come with swelling, bruising, or sharp pain. Imagine you rolled your ankle, strained a muscle at the gym, or tweaked your back while lifting something. You've likely just caused some micro tearing or trauma to your muscles. And your body reacts with inflammation, which brings swelling, redness, and heat to that area. That's where ice comes in. It helps to constrict your blood vessels, reducing swelling. It numbs your nerve endings, which actually helps with pain. And then it also controls internal bleeding in the tissue early on. So use ice for sprains and strains, swelling or inflammation, bruises, acute injuries within the first 24 to 72 hours. And then how to use it safely. Use a cold pack or a bag of frozen vegetables wrapped in a towel. Apply it for 15 to 30 minutes at a time and wait at least 30 minutes before reapplying. Now let's talk about heat. Heat therapy actually works in the opposite direction, which makes sense. It opens up the blood vessels, increases circulation, and helps muscles to relax. And so this is ideal for chronic issues, tight or stiff muscles that need more flexibility and more blood flow. Picture waking up with a stiff neck from sleeping wrong or feeling that tight, nagging ache in your lower back after sitting all day. That's when heat can work wonders. So use heat for muscle tension or spasms, chronic pain, stiff joints, or before activity to loosen up muscles. Bonus tip, moist heat like a warm towel or a heating pad with a damp cover can actually be more effective than just dry heat. Avoid heat if the area is still swollen or you have an open wound or infection, or if the injury just happened. We don't want to add heat to fresh inflammation or a new injury. Okay, let's talk about some of the biggest mistakes that I see people make. Number one, using heat right after an injury. It might feel good, but it actually draws more blood to the area and can cause more swelling or make your swelling get worse. Number two, leaving ice or heat on for too long. More is not always better. Stick to 15 to 30 minutes, or you can risk skin damage or irritating the tissues. Number three, not knowing when to switch. After about 48 to 72 hours post-injury, switching from ice to a gentle heat can actually help to promote healing and get your mobility back sooner. If you're ever in doubt, just start with ice. There are cases where both ice and heat can be helpful, just at different stages. In the first 72 hours, go with ice to control swelling and pain. After that, we can switch to heat to actually relax the muscles and improve mobility. This combo can be great for things like sports injuries, muscle strains, low back pain flare-ups. You can even alternate between the two in a method called contrast therapy. But that usually works best after the first 72 hours and when swelling is gone. So quick recap and takeaway, ice for fresh injuries, swelling, bruising, things like that, and heat for tight muscles, stiffness, or chronic pain. Don't overdo it, and when in doubt, start with ice and check in with your chiropractor. Because remember, no amount of ice or heat can overcome a spine that really just needs to be adjusted. If this video helped you out, give it a like, hit subscribe for more tips like this to keep your spine and muscles functioning at their best. Do you have a specific pain or injury that you're dealing with right now? Drop a comment below. I am here to help. Stay free, stay aligned, and I will see you on the next one.